Hey, everybody. Welcome to Eden Alternative Live. And I have the unique pleasure. I'm Laura Beck, Learning Development Guide at the Eden Alternative. My unique pleasure is hanging out with Stephanie Parks today. And she is the Chief Development Officer for Alliant Rehabilitation. She's got over 20 years of experience working in eldercare. And she is a speech language pathologist and has a master's in business from Southern Methodist University in Dallas, Texas. Stephanie, and this is why we have her here today, she has a passion for helping elders maintain dignity and the highest possible quality of life. And so with that, welcome, Stephanie.
Thank you, Laura, and thank you everyone for your time today. I know that time is such a valuable asset. So before I get started, I just wanted to take a moment and express on behalf of Reliant and myself that it's been a true pleasure to work with the Eden Alternative team, with Laura and Meredith over the past few weeks, getting to know each other better and understanding our cultures and how well our philosophies fit together and possibilities of how we can actually partner and support each other in future endeavors. So thank you so much. And then finally, before we get started, Laura, I just wanted to have a quick disclaimer that Reliant works with a diverse group of senior living communities and each unique culture. And so if I misspeak or say, I'm a speech pathologist, words are hugely important to me, you know that. And obviously with my passion for dignity and the care of our elders, if I misspeak, it is not my heart. So just give me a little bit of grace as we move forward.
No worries at all. So just so glad you're here. It's been exciting talking to you, over the last couple of days and hearing a little bit about what Reliant's been up to, especially, in the shadow of the pandemic, at a time when we're learning a lot about the whole human being and the needs of the whole human being and how absolutely mission critical that is. And so the first thing I'm kind of curious about, though, is, we all have a story about how we landed in aging services. And I'm wondering what yours is. Like, what first drew you to elder care and specifically rehab?
Thanks for asking that, Laura. I don't want to bore people with all the details, but we all have a story. And my journey actually started, I was a pharmacy pre-med major and was sitting next, I believe people are put in our lives for a reason. And I had never heard of the field of speech pathology. Can you imagine being pre-pharmacy, pre-med? Never heard of speech pathology. And I'm in some boring chemistry class. And I was blessed with sitting next to a young woman who said, I'm a speech pathology major. And I said, what's that? And it started my journey. And then once I learned more about what that entailed, it included two of my favorite things in life that I really brings huge quality of life to every human, eating and talking. So I think probably a lot of, I think people would agree that is two pieces of life that bring quality to us. So changed my career and my major and my path, thinking that I actually wrote my master's degree letter to be accepted application into my speech pathology program. I wrote my resume around helping younger individuals who had experienced strokes or traumatic brain injuries get healthy and live long lives, live in a more normal situation and give them back life. Little did I know that journey would take me down a path of falling in love with our elders, and really felt like that was the population that, from the biggest impact of neurological disorders, dementia, Alzheimer's, Parkinson's, that stroke, that was where my heart was. And the rest is history. Here I am over 20 years later. Never look back.
It's so often what we hear, right? We tumble into this work and somehow, it's you fall in love. And so, that's why we're here. Absolutely. So that in mind, I'm wondering if you can paint a little bit of a picture for us today. Just, what's the scene? with therapy services in the shadow of the pandemic. What is it looking like in senior living communities that have rehab services right now?
Yeah, so if I can take you back, just bear with me on this journey. So let's think what it looked like before. I'm not exactly sure who's out there listening. So if you haven't been living it, maybe some of you, I'm telling you exactly what you already know, probably. But let's think October of 2019 for specifically for the Medicare providers in the healthcare side, the SNF side. We experienced the biggest regulatory reimbursement change that we had experienced in 20 years. So January comes and we're just getting accustomed to a different model and complete training all across the year of 2019 for the nursing staff, for the administrative staff, and for the clinicians, the therapists, PTOT, and speech in these facilities, in these communities. And not expecting that we were moving into a whole new world in March that none of us could have anticipated, right? So visualize October to January. That's a pretty quick turnaround for the biggest change in 20 years. And we were doing well with it. And our therapists, I think as an industry, everyone would agree, we're thriving with honestly, it's CMS got this one right. And what I was going to say in this industry is rare for us to say they really got this right on the first run, but they called it patient-driven payment model. And it was the first time, right, that in the history because again, over 20 years, we had fee for service, then we had prospective payment system, and we moved into patient-driven for the first time in more than 20 years, right? It had to be maybe 30 years. First time that they actually focused on patient-driven. So it was a complete mindset shift and a generation of, for us, for therapists, speaking on behalf of Reliant and the 9,000 clinicians across the U.S. that are serving our population, of now it really is about the individualized care. And it was right, and it is right, and it's still right. But it was so interesting that came at the right time, not knowing where we're headed, right?
Exactly.
So we gave the therapist the ability to practice at the top of their license. And we said, it's good, go. Do the right thing for the patient, which always had been the heart, but we had arbitrary guidelines that really didn't fit individual needs. So it's amazing that we fell into that in October. In January, we were having great outcomes. March hits and changed our world.
So what happened? Here you're on this new path. There's something to be excited about. And without question, the things that were already in motion were exactly what needed to be in motion. But how did that all go down?
Yeah. So what was good and bad, right? I mean, I believe there's a silver lining here in midst of all the bad. But let me take you down a little bit of the history and dark path for a minute. So our gym. So you go into a senior living community, and there's a gym with beautiful, hopefully, equipment. There's all shapes and sizes. Sometimes it's not. Sometimes there's a limitation to space. But typically, there's a lot of life in that space, right? There's energy, there's life. I mean, that is another piece of what drew me to this, is that in the facility, there's a draw to come in, and there's usually music, and there's lots of activity, and there's fun, and there's laughter in this space, right? And then the space, whatever size or shape it is, this gym in your senior living community. And people are drawn to it, right? They're drawn to the energy, they're drawn to the activity. And unfortunately, that was shut down, right? Completely gone. So we took what drew clinicians in and drew family members. Family members are there, everyone's interactive. It's a happy place to be. And it's quiet because we cannot have any communal interaction. But for a time, now we're moving back, but for a time, gyms are quiet. And therapists, I'm a speech path, remember, my face and how they interact with me is very important. And now we have a mask, and we have gowns, and we look scary. And how do we engage these human, this elder who has their hard of hearing. They probably, most likely in this situation, have some sort of cognitive deficit. They're isolated to their rooms and can't interact. And we have a challenge, a huge challenge. The facility, I mean, the nursing staff, everyone in the community had a challenge. But I'm speaking on behalf of the clinicians. It's disheartening when I'm a speech path and you can't see my lips. So PPE, right? We all have dealt with PPE for a while. And then what about the beautiful equipment? What about our physical therapists who want to put someone on a device that helps with balance or with gait training, or with standing frames and parallel bars and all the pieces of equipment that you see in these beautiful gyms that we've used for years, and now that's gone because you're not moving parallel bars down the hall, right? So we had to be very creative on how we achieved the same outcomes in the room in isolation with PPE on.
So amazing how resilient clinicians in this field have had to become, right? And how creative and how innovative. I mean, I know for me right now, I'm actually receiving physical therapy services out in the community, and that feels hard to get my needs met. So I can only imagine with the different parameters, how you guys must have had to really come together to figure this out.
Yeah, so on a positive note, so I just painted a kind of a dark picture here, but on a positive note, you're exactly spot on. Resiliency is the right word for everyone in this space, and that has a passion for our elders. So, and we've overcome many challenges over the years, and I believe that resiliency and those challenges made us rise to the top, even if we as an industry weren't perceived that way. For media purposes, there are so many great stories, and really highlighting those is what shows the resiliency and the success of what our frontline workers have done. So just from a high level, if you take approximately 900 senior living communities that Reliant represents across 40 states in the U.S., which is a small cross section, but I think we currently have around 15,000 of this type of community. And you take that and you say, we studied, and we were studying because of PDPM, but then with the change, I definitely would have expected to see a decrease in functional outcomes. So we're talking about what functional outcomes. So activities of daily living, ability to dress yourself, groom yourself, transfer on and off a toilet, walk to mealtime, be able to have a level that we talk about, when I say dignity, a dignity of who you are as a person, be able to feed myself, basics. And we're watching this, and we're meticulous on how we document this because we have to report it. Mm-hmm. And what we saw with the challenges, with the PPE, with being unable to see our faces as we're trying to say, stick out your tongue. And, if I'm trying to help someone swallow, there's a lot that has to do with chewing and moving the food and all of this. And we saw actually not a decrease in our functional outcomes. We saw an improvement over the 10 months. And I truly believe, one, it shows resilience, but two, it shows that in times of crisis, we learn to adapt quickly, and we learned to treat in a different manner, right? So we had to be very efficient and effective with what we did with very limited resources, because we didn't have the fancy equipment. We didn't have the fun gym with all the energy and the encouragement. It was one of our elders in a room with one of our therapists, a physical therapist, occupational speech pathologist, in a room working with their environment. And part of me wonders if we'll see later that increased, we had an increase in functional improvement because we had to work with their own environment.
Mm-hmm. That's what I was going to ask you is, what do you think that ingredient was that, made this surprise outcome? And that's what comes up for me, is it's something about being in the environment and the simplicity, but the effectiveness of the approach.
Absolutely. Yeah. We didn't have the luxuries we had before. And so, I'm going to go back to, I think it was an interesting, we had just provided training to be really smart about how you're providing care, because no longer are you given arbitrary guideposts under PPS. Now you're able to practice whatever your clinical judgment tells you as a PTO to your speech. And now use that clinical judgment, but use it in their environment instead of in your environment.
Yeah, and it's on their terms in a different kind of way, right?
Yes. Yeah.
Mm,
So silver
fascinating.
lining, I mean, again, it's not ideal, and we are actively working quickly, right, to get them back out into their communities being, having mealtime communal. I mean, I love a social meal. I'm sure that most of the listeners do as well. So that's important, right? That's part of the holistic well-being. But because they couldn't, really every individual in the community had to learn to rely on each other. And I also think that, Laura, is going to be something we see in the future. We had to collaborate, we had to work together, we all had to be in lock sync, right? you
Right.
we didn't have the ability to say, oh, it's someone else's fault, or the family. That's one, we would really rely on family to come in, and now we had to really think about things differently and be more of an emotional support as well.
Yeah, I love that you bring that up, because it's like a different kind of connection, and this we're in it together energy. And I wonder, like, how that plays into the elders therapeutic process, right? In terms of, we're in this together, and they feel it in the staff. Who knows? It's just, I think it's fascinating to hear that you had those outcomes.
Yeah, well, and we were very happy to see that. We were concerned, as you can imagine, that outcomes would have declined instead of improved. Like,
Okay.
and all we were trying to do is just maintain some sense of outcome for the elders that we were serving, and to be able to say that it improved. And I'm hoping that that shows across the industry. And obviously, it takes some time to actually get outcomes and publicly available information. But based on the research we're doing, we're seeing that as an industry, we held strong.
Well, and what a wonderful bit of feedback for the team, right? At a time when everyone has got so much uncertainty they're dealing with, they're overwhelmed, they're probably scared. And to get the feedback that, you know what, in spite of it all, look, we're doing even better. So I love hearing that that was something that, your staff could take away. So that's,
Laura, one other, just on a side note, something that historically has been, I believe, a misnomer, because I've worked in really effective teams that collaborated, but there seems to be a misnomer that there's a disconnect between therapy services and the nursing staff, right? And that there's not collaboration, and that we believe that is key to success, pre and post pandemic. But now more than ever, I think we've proven. So here's part of also the creativity, right? So not only bringing in technology, and I'm not even saying, like, I mean, I know there's a lot of telehealth information, but we're a high touch business. It's hard to teach somebody to walk or to feed themselves again without being right there. There's that we appreciate, but that's not the big picture. I'm talking technology as a speech path to saying, let me show you how you can communicate with your families, and let me teach you how to use this device so that you can communicate virtually. And that takes multi-step processing. It takes ability to use fine motor skills, right, to log in or to use either a smartphone, an iPad, a computer, right? There's visual considerations. There's audible considerations about, let's have enough vocal control that they can hear you virtually, which is different than when you're face to face and you can see visual cues, right? There's a whole lot of teaching and learning that goes behind the scenes for communicating in a virtual world versus face to face. And I was super excited to see that we were able to add to the quality of life and to allow our elders to communicate with their loved ones when confined into their rooms. And it was a big piece of the puzzle. In addition to that, I think another really cool story is that the one of the misnomers, and actually maybe not so unreal in many cases, is that the therapy department, the rehab, the gym, the fun place would be set hours, and it usually didn't carry over into the evening meal. Occasionally, but not typically. And what we started doing, especially when our long-term partners, providers started saying, hey, we're having issues with even delivering meals. We're not set up to deliver 180 meals to individual rooms. We're only set up to deliver in a finite number, right? Or 200 meals to individual rooms. So we started staggering our staff, and if self-feeding skills or dysphagia, swallowing, was part of our treatment plan, or even the walking or sitting up, and all of those pieces are typically part of our treatment plan, we would stagger staff for all 3 meals. And if you're in the last meal and you have one of our elders on caseload on our treatment plan, we would deliver the meal and assist with the facility or the community to make sure that everyone was able to be fed on time and have a hot meal. And there were pieces of, again, integrating the clinicians, the therapists into everyday life that really became valuable.
There it is, right there. Yeah, sometimes we just need to stay focused on what's happening in the rhythm of daily life to get our answers, right? So I love that. That's awesome.
Or I had a professor way back in way back in grad school, and he said the best therapist I've ever seen can take a pen and a piece of paper and have an amazing therapy session.
Totally. This is like right there. It's just sometimes it doesn't have to be rocket science, right? The proof is right there. I have a question for you. So this is I mean, you've really done a great job of giving us some perspective around what the scene is in your unique niche, right? During these unprecedented times. What do you believe will be the lasting impact on the future of rehabilitation post COVID-19? And like, what just flares would you throw up for other organizations like yours?
Yeah, so it's a great question, and I don't think it's just organizations like mine. I think it's anyone in senior living, right? Anyone,
Correct.
Because again, we're talking about collaborative care here, right? But we've heard a lot of negative. We've heard a lot of doomsday. We've heard a lot of the elders we care for are going to show major declines in function, both mentally, cognitively, physically. And so as I was just preparing and thinking, putting my thoughts together, because we live this every day, but to actually be able to share anything that I think is valuable for others who are listening today, hopefully, there is a recent article that I thought was really hopeful. So it's from the Journal of American Medicine, and a respected journal. And it was talking about how there's a research study going on actively, and we don't have all of the data yet for post-pandemic, but you hear a lot about the depression and the mental health side of post-pandemic, post-quarantine. And this is an international study. So I am very curious sometimes how other cultures, other countries are handling their situation, their crisis. And I'm sure we all are, to learn from each other. Yeah, it's a small world. So in this JAMA article, it was recently published, and I'll be happy to share the link if anyone wants to see it. But as I'm reading it, it was interesting because they said, and I had not heard this. So those elders, so they looked at the population as a whole, and younger population, 65 and younger, and they grouped it, but 65 and younger showed a higher, significant increase in mental health issues than those 65 and older.
Wow.
And even more so, even less degree, those who are already in a senior living facility, community, or some type of communal living. And it didn't go into a lot of the thought process behind that, but I'm going to overlay a little bit of what I'm thinking is that they already have experienced elders have experienced a lot of life. Now, it did talk about wisdom, and I do think, Laura, that for the eating alternative, that you would really appreciate this article, because it said there is a correlation, and it's rare that you see in a medical journal. There's a correlation between wisdom and their ability to handle the stress and the trauma of being quarantined.
So right on, yes.
I was like, this was meant for me to read. This is perfect for our conversation today, because there is a correlation there, and they're saying there's a real correlation. So I would encourage all of you to read the article. The piece I took away obviously had to do with therapy. So I'm just going to share this one short. I don't want to bore you with reading it, but I'm going to quote from the journal. It said, "Clinicians must recognize the importance of non-pharmacological approaches." So let's move away from just giving them medication to fix this mental health concern. More effective than pharmacological therapy in the treatment of chronic stress, anxiety, and prolonged grief include cognitive therapy, manualized therapy, physical activity, greater connectedness, compassion training, and engaging in spirituality as appropriate. These approaches have also been shown to enhance coping, promote resilience, and reduce loneliness. Spot on.
Spot on. I mean, so obviously, it'd be great actually to get this link at some point. Maybe we can follow up, stick it up on Facebook later.
Sure, yeah.
But what I love is, so, I had shared with you that we have a white paper for the Eden Alternative Domains of Wellbeing. And just for our audience, I'll just share them again, that they are identity, connectedness, security, autonomy, meaning, growth, and joy. And so everything you kind of hit there, right, lines right up.
It does.
It's so I love that you share that, and that's an excellent, I think, sum up of what is the data that's coming out, and I'm sure we're going to be seeing a lot more, right?
I hope
so that we can be prepared for that, and to have a medical journal finally actually call out wisdom as a strength that might be something that does build some resiliency at times like this. I love hearing that. So based on what you've just shared and what you and your colleagues have picked up and learned over the last 10 months, so what are some of the ways that the rehabilitation field is stepping up to meet the needs of the whole human being in the senior living environment?
Yeah, great question. I love talking about the physical, but also we know that we have to bring, and I say physical because typically now as a speech path, I'm going to backtrack for just a minute, Laura. So what's funny is as a speech path, I'm intrigued by the human brain, right? So typically, and it's almost a joke, if there's any PTs or OTs listening to me, they're going to laugh if I could see you. We joke amongst each other to say speech takes head and neck, OT takes the middle body, right? So activities of daily living, arms, and physical therapy deals with lower body, gait training, transfers, walking, being able to be mobile. And this has been a joke because it's not accurate. We work together and we look at the whole entire human. But I think for maybe outside the walls of the gym, people think that as well, that we break them up. And so speech is dealing with eating and talking and thinking, and occupational therapy is dealing with feeding and dressing and grooming, all the things that deal with the arms. And then, or maybe to the layperson, occupational therapy means I'm going to go work again, which that's not what we mean, right? Not necessarily. Work in whatever it is that is meaningful to you, yes. And then lower body, physical, like exercise for the physical therapist. And so as we're talking about that, and I say I love the physical side, when you think wellness programming, I believe, and maybe you guys can correct me if I'm wrong, but I believe, and please, I don't see any chat, but if anyone wants to talk, go ahead, because we're very having conversations, chat away. But that if you look at the physical aspects, we know we have a high risk right now. So I just shared with you that we're not seeing mental health declines, but I think we can all say that, there will be some cognitive, I even think from, normal active adults or even children being confined and not being exposed to other individuals, we're all experiencing some aspect of that, right? And the study said that we, 65 and younger, are experiencing that to a more so, right? And maybe it's because our elders don't need as much stimulation, or they've already had the experiences and can rely on their memories, hopefully, and that we said that they're wise enough to know this too shall pass, and this is a moment in time, and they have dealt with much more than we have, right, from a trauma perspective and world changes. So one point I want to bring out is that there is research, and this was also from JAMA, from the medical journal. 1% of lean muscle loss for every day that any individual lays in bed. So how many days have we allowed our elders to be laying in bed, because their rooms they're confined. So even
Right.
getting up and sitting in a chair is different than walking down the hall, going to bingo, interacting, right? So if you're, and I don't think any of us can say we haven't experienced that, right? I mean, at one point, we all have our little Fitbit walker, Apple phones. And at some point during the last 10 months, I looked down and said, wow, I went from running through airports to walking from my bedroom to my office every day. And my office is about, I don't know, 50 feet away. It's right there. So, so I think we've all experienced it. And so we really have to be thoughtful physically about the senior living elders who have been, and I would say for any elder who've been confined. And now we've opened up the whole world, or we're about to, right? As vaccinations are out there, and we're saying, okay, now, well, even now you're saying for those living in the community, you can get in your car and go get a vaccine, and we're hoping they're going and doing it. Be safe, because once you've gone from being confined to a finite amount of feet that you're walking every day, especially if you're living in a senior living community and you're within the confines of a certain four walls, your world just opened up. And if you've lost, us as a population, but even more so our elders, have lost 1% of lean muscle mass for every day. And we're sitting at probably about 10, 11 months now.
Yeah, it's terrifying when you lay it out like that.
So I'm saying we need to be aware. We need to be aware. We need to watch for the and I want to focus not on necessarily just the physical aspects, but I think this is a huge takeaway. And Laura, as I was doing my research, I'm like, this is huge, because we need to be mindful of how risky that is, because we also know with our elders, especially those who are more independent, who, independent living either in their home or in their independent living community, they're accustomed to being able to go and do and be free and live their lives.
Exactly.
So if you've confined them, we have said, stay home, be safe. It's the right thing to do right now. Oh, now open the doors. You had your vaccines, and once in a few months from now, 75% of America, if Fauci is correct, by fall, we're opening the doors to some sense of what we knew before. Then let's don't fall. Let's don't think that we can do what we did before, because we're not as strong as we were. Our elders are not as strong as they were.
Yeah, absolutely.
And I think it's more about our so it's not, this isn't a therapy problem. This is one for physical therapists, occupational therapists, speech therapists. We want to help, but it takes a village. And so it's going to take family members recognizing that. It's going to take the physicians who are what about when they go and get their vaccination? It's the first time they've seen this particular elder for however many months, and they say, hey, how are you moving around, and how do you feel? And, well, I've got some pain, but I haven't seen you in a while and I haven't done anything about it. Well, you have pain because you have arthritis and you're not moving. And you have, you had a joint surgery 20 years ago, and you've got arthritis moving around, and you've got to continue to move, but how do you move when you're confined? So I believe, it's not me personally, we believe as an industry, and Laura, I'm not telling you anything right now that you don't know, we have a huge challenge ahead of us. And it's not just, I think for a population, it's the mental health. I think for a population, not just our elders, that it's a depression piece. Based on the research I've recently done, it feels more like for our elders, they're going to be resilient in the mental health and the depression and the isolation, because we've been addressing that for a long time, the hopelessness, all the things that the Eating Alternative stands for that we have to work on. But we've been addressing that, and this is not new for them. This is a problem that's been here for a very long time.
Exactly.
Now it's about, let's not cross it. Real story. Laura, I don't want to get too personal, but we love real stories. My grandmother decided to walk across the street and check her mail. My 92-year-old grandmother decided to walk across the street day after Christmas and check mailbox, which she's been doing for a very long time. And she tripped and fell and broke her hip. And it's my belief that we're going to see a lot of our elders that trip and fall in situations where they're very comfortable and have never tripped and fell before. And once you break a hip, it's a spiral.
It's really hard. Yes.
At any age, but especially elder.
So, wow, the process of being proactively engaged around these possibilities, yeah, that's really something for your field.
And
I'm having
so,
are you there?
Laura,
Okay. I lost you just a minute.
I was going to say,
back.
Just a minute. It may be my internet. But if you can hear me, I wanted to talk about a holistic approach. Can you hear me?
I can. You can go for it.
Okay, great. So one thing that just forward looking and talking about the future, one thing that Reliant has focused on, not just the last 10 months, but as is looking at opportunities to not just address those in our care, those who have had a change of condition, who have physically declined, but looking holistically at the population in which we are able to address. And how can we do that? I mean, so if we have a staff of highly trained clinicians that are there, but they only see a small fraction of the elders that are available that need help, how do we provide some expertise and some services to all? And it's not unheard of for a therapy provider like Reliant to provide some type of wellness programming. Typically, that wellness type of program would only be physical. So I spent a lot of time talking about physical because, that's our space and that's what we know. Speech, I think a lot about the brain as well. But not just decline of function, but maintenance, maintaining wellness, whole life, quality of life, all of those aspects that I'm very passionate about. And what we've done is built out a program that looks at the individual. So we talk about person-centered. And again, CMS is kind of moving that direction with a slow walk with the patient-driven model. But the Eating Alternative was at the forefront of this. And so I'm not speaking anything that you don't already know, except that we have built out resources and a program that we believe is different than a typical wellness program, because we're not just talking about yoga and Tai Chi. We're talking about holistically body, mind, spirit. And so, Meredith, if you can just show one of the resources, what we do is either train staff or we actually provide the trained individuals to implement this program. And one piece of that is a welcome intake form. Now, you're going to see it in a paper form, but we also have it in a digital format on an app, because technology, I didn't even talk about technology. We're running out of time already. But technology is a huge piece of what we did during pandemic and will continue to do as an after effect that is very important to family members and loved ones for communication. But as you can see here, we have built out pathways that we can, it's really a cookie cutter open book, but it's not cookie cutter, because what this does is it looks at, I say cookie cutter because if someone says I'm passionate about dance, then we dive in and we take a deep dive. So you like dance, let me open my dance pathway. And then if you look, there are daily, there are weekly, there are monthly, and there are annual or semi-annual activities or events that this individual elder can choose or not choose. And it's there, it's very customized. They can choose or not choose to participate in. So what we do is take a deep dive analysis, an intake, an understanding of who this individual is as they're coming into our care. And it's not just, do you like to dance or do you not like to dance? And I'm just using dance as one high level example, but it would be, how do you like to dance? What type of dance do you like? Did you like to watch Dancing with the Stars, or do you like to actually teach dancing? And we've developed out these pathways, just like we do on our clinical pathways based on diagnosis, but this is based on individual needs and wants, and what actually makes them up as a person.
So I'm just noticing that
there
you are. Okay.
Oh, sorry, Laura.
Okay, go for it.
Can you hear me? I don't know if it's.
You're there. You're back. You're back. Go for it. Dive in.
Okay. Here we are in technology world. So what we found is that it's a one size fits all. And so what we call this is a concierge approach. And it literally is a deep dive into the body, mind, and spirit and what this individual needs. And when I say cookie cutter, is because we don't have to have a specialist to do this. We can train anyone to walk our elders through this pathway and say, what's important to you? What is it that makes you tick? And we found some great stories, Laura. So we found a professional ballroom dancer that created some pathways for us. And in her journey, she ran across one of our elders that was in one of our communities who was a professional ballerina. Now, unfortunately, she was struck in with a physical neurological disorder that made her unable to physically dance, but she was able to assist and be part of training and educating and working with others around her, and gave her quality of life, because that was her entire life and what brought her joy. So, these the programs can be adapted, but it's about finding out to the core of who these individuals are. So a couple of fun stories. We actually, in dancing, our Laura has been with us, not you, Laura Beck, but Laura has been with me for 10 years, professional ballroom dancer, competitive dancer. And she created a program called Dancing with the Seniors, and it's been on TV because she's so passionate about it as one of, Reliant's own. And she walks into our residence rooms under our care and says, do you like to dance? And we have found they may be in pain. Their feet may be swollen. They may not be able to, physically move very well, and light up. It's about finding that light, finding that makes you. And I witnessed this once. She sat down and said, do you like to dance? And she goes, my golden dance shoes are right there sitting in the closet, and I'm not giving them up. But she would never come to physical therapy to do respirator or walk or do any of the boring things we do in the gym. But she danced, and she did a lot of work to be able to dance. And so that's the meaningful stories that this creates, is thinking outside the box, meeting each individual human where they are. And I believe that's why we're getting better outcomes.
Well, and what I love about what you've created is that it being a pathway, right? You have that opportunity to explore the nuances and all of those tiny little customization points that make it so unique to each individual.
Absolutely.
Yeah, but sometimes we do have to start with something that gives us a frame to build out from, right? So yeah, I don't even see that as cookie cutter. I mean,
I hate saying the word cookie cutter. I don't want to say like, so we have another program that we call it's marketing for dummies, because I'm not a natural marketer, but I can open it. I can get all the resources I need. I can script it, but then it's all about personal and human touch, right? It all is. I mean, everything that we do in a service-based industry, which is what we do, we care for humans.
right.
It has to be about the individual. And that's what I think is the difference with doing a wellness program holistically versus thinking about just let's do sit and be fit, right?
Exactly, because everyone's doing the same thing. It's really not right. Exactly.
Yeah, we can all log into an app and do sit and be fit or jazzercise or whatever. No, this is about literally creating a personal pathway for each individual elder that are under our care. And I'm not talking remove the skilled therapy, because PTOT and speech is a small piece, because not everyone in a community is under care of a physician with a prescriptive care, but we're looking at wellness holistically. And maybe for someone who's never exercised, I can't see my dad in the exercise class, right? But you give him an automobile brought in on a, like in pieces, and he's going to build it, right? So that's what I'm talking about. Let's think more about this individual. And so one of the stories was that we had this is a real story. There was a failure to thrive. He's asleep all day. This is one of our cases. When clinical cases, everyone's talking about it, and it's, well, he's depressed, or why is he so lethargic? Oh, it's failure to thrive. And ultimately, when you really talk to the night staff and you think holistically about this elder, and then we got on the phone and started talking to the family, no, he's awake all night. Well, don't give him medication to sleep at night. He was a night shift worker and he wants to be awake at night, and it's natural. And we're trying to force him into our world because it's more convenient or because we can't think outside the box. So that's really the heart of when I say wellness. It's let's map out what fits for this individual,
right,
not what fits for us.
And so what I'm hearing you say is that over the last year, between launching this new initiative and finding yourself stumbling into a pandemic, you've had to think out of the box a lot. That you're getting a lot of practice. Yeah, you're getting a lot of practice, and look what's happening. You found out you were having great outcomes in a scenario where you didn't expect to have them. And so how long have you been using the pathways? How long has this been alive in the work that you do?
So it's an evolving answer for me, or for our journey, because we as with, I would say, most of my type service offering, that my competitors, if you will, we all have some type of wellness programming. But I think the evolution has really come in the last 12 months of holistic thinking, right? So I would say 18 months for right sizing and applying the right therapeutic approaches with the onset of the changes that affected all of us in October. So then we had to start thinking at top of our license, and I am a doctor of physical therapy, and they did teach me that in school, and I can do that here. And so that was, I think that was a renaissance of long-term care therapy for clinicians. But then there was an evolution during the initial stages of the pandemic and quarantine, and I believe there's a continuation of that we added and decided to really focus holistically, because you can't get a good outcome, Laura. There's no good outcome if you're only looking at a muscle or a joint. That doesn't work. And shame on us for ever thinking that it did, because it doesn't. We have to know who that person is, meet them where they are, and join their journey to get them where they want to go.
Absolutely. Well, it's so exciting. I see that Meredith is making sure that folks have access to downloading some information that you've provided. So I hope that if you haven't noticed, if you're joining us right now, in the comment box, there is some information so that you can get some samples. Would you describe them as samples? Is that what you've made available?
Well, actually, and quite honestly, I have been so enjoying the conversation that I haven't even looked. I just now clicked over and saw that there is some activity over here. So thank you all for interacting. Um, I have not read all of the comments, but I'd be happy to answer offline any questions or comments. But in addition to that, we actually have decided to share we call it a welcome questionnaire. And it's the questionnaire that we use to take a deep dive into who you are, right? What do you enjoy? What makes you tick? And this works for twofold. One is it works from if you're not in a CCRC or if you're not an ILAL and you're an activities program in a SNF, you can use the same. Social services should use it. If you're a therapist, you can use it to really figure out who this individual is. I would recommend, again, that it's a collaborative approach. You don't want to ask the same questions 100 times. So you should assign, we will share the entire intake form. Thank you, Meredith. I see that you shared it here and it shows 3 of our pathways. We're not giving all the pathways, but we are sharing, and we want to because we think it's the right thing to do. At least it's a template for you to start. And we're not saying this is the final answer. Again, it's an evolution. And if someone else has other ideas, I would love to hear your ideas, because I even though this is something that Reliant created, I do believe that we're better together for all of us sharing ideas and helping our elders. So if you're interested in this, please just, there's a link. I hope that we've got this here. And I know that Meredith was going to post it.
Yep. It's right up here. It says www.reliant-rehab.com/wellness-questionnaires-landing page slash. Does that sound right to you?
Copy, cut, paste that, or you can email me directly. It's sparks@reliant-rehab.com, or you can find me on LinkedIn. And there's no obligation to hear anything other than, here is a downloadable resource, hopefully a tool. And, if you would like additional information, if you would like to understand more about what we're doing actively currently in our communities that we serve, we'd love to talk to you about that as well.
Well, I'm happy to let you know too that there've been a couple of comments already that people are really responding to the pathways. Somebody says, love this. Somebody said, love the pathways. We just had, I think I pronounced that as Jalix, say that she just stumbled on today and was really happy to be here. So it's always great, right? Facebook Live offers these opportunities to stumble in, and what do you find? So glad you're here. Glad you joined us. Is there anything else that you want to share before we close today? Anything else?
I have really enjoyed the conversation and would love to continue the conversation with any of the individuals that listened. And, hopefully if you didn't get to hear Jalix, if you didn't get to hear everything, there will be a link that you can log in and hear the conversation. I think, again, we're better together. This is a journey, and anything that we can do to improve outcomes, improve care, improve the quality of life and dignity. And Laura, one thing I didn't get to say is that I actually early on had an amazing mentor that said her personal passion and what caused me to completely buy in was that she wanted the U.S., because some cultures do not feel this way. She wanted the U.S. to change their mindset and to treat our elderly with the same dignity, care, and compassion as we do our young, and to treat our aging population the same as we do our newborns. And that speaks a lot to a mother of 3, because I know that, Mama Bear comes out with my babies. It should for your grandmas and grandpas too.
That's beautiful. Thank you for that. Love it. What a perfect note. I really appreciate this conversation, Stephanie. It was very enlightening for me as somebody who's not immersed in the therapy services world. So it was really interesting to hear what you're discovering, what you're anticipating. And I think you gave people some great, just some warning flags, some things to be aware of, but some opportunities for hope. And, that, hey, if you have a pencil and a piece of paper, things might be all right. So thinking out of the box, love it. Thank you for your time. Thank you for those of you who joined us. And have a great day.
Alternative